Welcome to Ask Asbury, where we have conversations about wellness, purpose, and living life fully at every stage. February is Heart Health Month, and this month's conversation is especially meaningful to me, both personally and professionally. In April of 2024, our friend and colleague, Andy Joseph, who is general counsel for Asbury Communities, experienced a major heart attack followed by cardiac arrest. And what makes Andy's story like especially powerful is that Andy is the pillar of health. Andy is the person who comes to mind when you think about doing everything right as far as healthy lifestyle goes. So Andy has agreed to come on here today to share this conversation with us, not so much as a conversation rooted in fear or another top 10 list of things you should do for your healthy heart, but it's more a testament to preparedness, what it takes to survive something like this, I think, and other more intimate lessons, I think, just on life in general. So, Andy, thank you so much for agreeing to be here today and share your story with us.
Well, Sue, thank you. It's a pleasure to be here. I'm happy to share my story to the degree it's helpful for other people. So I really appreciate you asking me to be on, thinking about me.
Oh, well, thanks again. So I want you to tell your story about what happened because it's a very powerful story. But before you do that, what was your overall impression of heart health before the fact? Like, what were what were you trying to live your life to do?
Yeah, and Sue, as you and I have talked, I have a history of heart disease in my family. So it was something that always sort of overshadowed my life that I always thought about, even from a young age. My father died in 1970 of a heart attack. He woke up in the morning and died. And certainly back then, there wasn't the kind of EMT response and support that was such a blessing for me. But his outcome, always was a big impact on my life. So throughout my life, I always thought about cardiovascular health. So cardiovascular fitness from my 20s until this point and continuing is always something that's very important to me,
Mm,
that I make time for in my life.
yeah. So did you have any inkling that something was going to happen around the corner?
No, he was 38 years old. So I remember those when I was approaching that age, I was, getting more and more concerned, right? And but nothing was indicating in terms of my health. It was just my mental thought process of, wow, I'm getting close to the age that my dad died. So I went to a cardiologist and I actually went through a nuclear stress test at age 35, and then at age 40 and 45. And what's interesting is all of those stress tests came back negative, meaning in a positive way. The doctor said, you're doing great. There's nothing indicating a problem. Just continue what you're doing. And I don't think we should continue these tests because it's not a good idea to keep putting nuclear isotopes in your body for no reason. So I said, okay. And off I went, the last one being at age 45.
Wow. All right. So walk us through this day in April of 2024.
Yeah. Surprisingly, it was my first grandchild's second birthday, April 26th. So I say that he and I were born on the same day in a way.
Oh,
I had swam in the morning with my master swim group. It's an hour workout. And as I exited the pool, I felt like something was amiss. What's surprising about this is I didn't think anything was wrong with my heart. I didn't know what was wrong. But I showered and got home, and when I entered the house, things were sort of getting worse, as I remember. And I told my wife, and God bless her, she realized I'm not one that really sort of complains about things or overblows health related things. So she knew something was wrong and called 911.
wow.
And certainly it's a long journey from there. And I know we don't have a lot of time, but just a few things to highlight. I did suffer, as you mentioned, the heart attack, which people can actually have heart attacks for quite a period of time and not necessarily have cardiac arrest. So that's an important takeaway is that people need to understand when they're suffering significant sort of um, different types of indicators of heart distress, they need to get to the hospital quickly. They need to call the EMTs. But anyway, in my situation, it just happened very quickly. So my wife found me, and my heart effectively was not working anymore. And through the coaching of the 911 operator, she performed CPR for 6 minutes. And as I like to say it, one heart kept two people alive for a full 6 minutes, which is a long time. Um, and my wife is no expert in CPR. She had learned it years and years prior when she was a kid, but it's a very, very simple task to perform. But obviously, it was crucial in my story.
Oh my gosh. Did you have those classic symptoms like chest pain and left arm pain and like what were your symptoms that you noticed?
Right.
Like
I
from the
didn't.
time of the pool even.
Yeah, no, I don't recall Sue ever feeling like the weight of the elephant on the chest. You hear that, or as you mentioned, the left arm pain, or very painful, like what feels like a muscle pull in your back. I didn't. My symptoms, as I recall, was simply almost like I felt like I was asthmatic in a way, like breathing was a bit of a struggle, but no pain, no chest pain, no arm pain, which the doctors tell me sometimes you just don't have those indicators.
Wow. That's really something. Um, so your wife did CPR for 6 minutes, and then when EMT showed up, was everything great? Were you okay, or what happened then?
No, and I don't even remember any of this because I was my heart was being stubborn, but they knew because they hook up EKGs. They knew life was there, and God bless them. They worked hard. They worked for over an hour in my house. They shocked me 5 times. I've read the whole transcript, and they just kept at it. And their training is incredible. We're very blessed to have essentially EMTs and the support systems and the technology and the advances to help us survive an event like this. But they just did not give up. And eventually, when they felt like I was stable enough, they loaded me up and headed off to the hospital. And of course, the hospital knew I was coming, so they were prepared and ready, which was also a great blessing for me.
Wow, Andy, this such an incredible story. In hindsight, let me ask you a little bit of a maybe deeper question. Doesn't have to be deeper, but did you come out of this changed in some profound way, mostly related to your health? Um, because I know you were already trying to do all the things right, prior to this, but did you learn any hard truths or misconceptions that came to light or shift in perspective about anything?
Yeah, there was a lot that happened, Sue, when I was in the intensive care unit for 5 days, and a lot of thinking. And from a health perspective, Sue, I mean, I had been doing everything that I should have been doing, and maybe I should have been under the care of a cardiologist when I hit age 50. But I don't really beat myself up too much about that. People ask me, what did you change about your life? Did you eat better? Well, I was eating well before. I was exercising. And
Right.
and so there really wasn't changes in that regard. I'm very lucky and blessed to be back to doing all the things that I love, swimming and biking, and really have made a remarkable recovery according to my cardiologist. So it's more on the other aspects of life, the emotional, the mental, the spiritual, that have really struck me in these 2 years, almost 2 years since that event. I would tell you this, I'm much more in tune with people suffering in the world. That I think there's a lot more suffering than we actually realize. That if we look around just at the people around us, if we knew the kinds of suffering they may be going through currently or have gone through, I think we would be surprised. And that, we talk about giving people grace, and the foundation for that is really appreciating that people have gone through really difficult times. And that's a good place to start when you're going to give people grace for whatever reason, is to understand they've suffered. So I
Hmm.
think that was one of the takeaways, is that I'm just attuned to the suffering in the world. And I don't want to be too pessimistic, because there's certainly a lot of joy in the world, and we're blessed to have it, but there is a lot of suffering.
It dawns on me as I wear the sweater that says love on it, during heart health in February, is that, we have that other symbol of love, which is the heart. And I think that's a kind of an interesting parallel. Your physical heart goes through something traumatic, and your existential heart, comes out stronger than ever. So I think that's really beautiful, Andy. I didn't know we were gonna touch on something so beautiful. I think that's awesome. So my last question for you, if there's somebody like you in the world who's doing everything right, heart health doesn't apply to me, I exercise, I eat right, is there anything related to risk or preparedness that you would recommend to people like you?
Yeah, the cardiologists, the several that have looked over my case have said, your fitness level was really important to your survival, because there was another aspect that people don't often think about with heart attacks, and it's your brain. Your brain is actually one of your more vulnerable organs in your body, and your heart is actually fairly resilient. But your brain does not suffer blood loss or blood flow, or lack of blood flow too well. And so one of the aspects that my cardiologist talks about is how important that CPR was, as he says, to perfuse blood through my brain, as opposed to just my heart and other organs, because I could have survived, but I might have survived in a way where I would be, suffered significant brain damage,
Yeah.
which is again such a blessing that that did not happen. So, um, the way I look at it, Sue, is, you know, we need to prepare ourselves with what's coming in life. And, the analogy I use is, I was getting ready to run a race that I didn't know was coming. And thankfully, I had prepared both physically, but also spiritually. I am a faithful Catholic, and that has been very important to me in enduring all of the aspects of what I went through. So I think that's an important takeaway, is that, we need to take the time to prepare ourselves mentally, physically, spiritually, for all that might come our way, if that's helpful.
Wow. That is so helpful, Andy. That's so much better than a top 5 things you should eat for heart health. I mean,
Of course, all
I,
that stuff is important too.
it's so important, but we can read that at the grocery store in a magazine, like I think I think what you're saying is, so it's important for resilience and what we talk about anti-fragility, but it's not just physical, life stresses you from all kinds of directions.
Right.
And I think your point about just being prepared for all of it, is is the most important takeaway, I think.
Sure. Exactly.
Yeah.
So,
Andrew, thank you so much for sharing your story. I know it's very deeply personal to you, and you're very generous with your heart and sharing your story. So thank you so much.
been my pleasure, Sue. Thank you.